All right. The next team is BreJona Whitlock and Kedon Newton. Their program is called FlourishRx. BreJona is a food justice coordinator, full spectrum doula, and communication strategist committed to advancing health equity in low-income communities. Drawing from lived experience and community-rooted wisdom, BreJona designs and leads initiatives that address the social determinants of health, particularly for individuals living in food insecure environments. Their approach is grounded in sustainability, cultural preservation, and mutual aid. Through projects like Nourish and Flourish, they empower communities with hands-on skills in food preservation, land stewardship, and ancestral practices to help people reclaim the relationships with food, wellness, and one another. Kedon is an addiction medicine and psychiatry fellow at Metro Health, Case Western Reserve University. Please join me in welcoming Kedon and BreJona to the stage.
Good evening. As mentioned, I'm Dr. Kedon Newton. I'm actually now an addiction psychiatrist at the Cleveland Clinic. Recently graduated from the Addiction Medicine Fellowship at Metro Health.
All right, and I am BreJona Whitlock, Food Justice Coordinator, Sustainability Advocate, and Full Spectrum Doula. Today we're introducing FlourishRx, which is a produce prescription and food equity program that aims to transform food from a commodity to a powerful medicine.
Here's the reality. Food apartheid is not just about hunger, it's about health outcomes. In neighborhoods like Lee Harvard, food scarcity leads to preventable chronic illnesses like diabetes, hypertension, and it can worsen substance use disorder and mental health illnesses. How, you ask? It's because chronic stress from trauma and malnutrition literally reshapes the brain from an early age. And these are upstream problems that downstream medical systems are trying, but they're failing to solve.
So FlourishRx addresses this at the root. We go beyond prescribing medicine and we aim to prescribe food, community, and empowerment. We go beyond traditional healthcare and we strive for community wellness. We partner with local farmers, growers, and cooperatives such as Little Africa Food Co-op and Urban Farming Collective to make sure we're addressing more than just poverty and health issues, but also the underlying factors of sustainability and transportation.
Through government food programs, prescription grants, and value-based care models, we ensure growers are paid to heal. And there's typically three components how this can help farmers. In the Wholesome Wave pilot, it showed that about, on average, farmers that participated in prescription produce programs saw an increase in revenue from 15 to 20%. It actually guaranteed demand. It was predictable. Farmers didn't have to depend on like seasonal shortages, and they would have access to reliable on-demand customers that came via the produce prescription program. It was also a local economic multiplier. For every dollar spent on local food, $1.60 to $2.60 actually circulated in that local economy, according to the USDA. And it actually provided an expansion of market for farmers. It provided access to clinics, local food hubs, hospitals, would reduce the reliance, like I mentioned before, on like seasonal markets. Health system win too, and I think you've heard some of this data before. When participants are nourished, they visit emergency departments less, and they manage their chronic illnesses better, leading to financial savings for insurers and institutions. As mentioned before, one of the biggest winners in the savings is Medicaid. Through a model through one of the cardiovascular quality and outcome metrics, it showed that by providing produce prescriptions to 6.5 million more persons, that it decreased cardiovascular events like heart attacks by 290 $292,000 over a lifetime, which led to $39.6 billion in savings. There's a return on investment, as been mentioned before. In the studies I saw in JAMA, for every dollar invested, there was actually a $2.42 return in the cost of medical savings. And this largely came from reductions in emergency room visits and hospitalizations. And in the Washington, D.C. study, produce prescriptions decreased ED visits by 40% and led to 20% fewer hospitalizations.
So to make this possible in Cleveland, we are currently asking for $300,000 in funding. This would expand FlourishRx, scale our nutritional program, and build data infrastructure. To provide more details, we would like to include in that our website maintenance, marketing and outreach, a food delivery program, which would include a food truck. We also want to have a tracking system for our feedback and prescription usage, preservation and nutrition classes, as well as farming and gardening classes.
With your support, we can show the healthcare industry what real prevention looks like and make it profitable. FlourishRx is bridging hospitals to harvest. It's healthcare reimagined.
Are you ready to grow with us?